Adverse childhood experiences cause trauma and affect us on our entire lives. What are these experiences? How do we address them and lead a mentally healthy life? Dr. Craig Corp is here with Sutter Health and the Sierra Foothills Medical Society. Doctor, nice to have you here. An important topic. We all have childhood experiences.
Right, sure.
What are adverse childhood experiences that we're talking about?
Well, thank you for having me today. I really appreciate it. So adverse childhood experiences, or ACEs, are traumatic or stressful experiences that people have under 18 years of age. And what's significant is, we've known for years that people with childhood trauma have higher risk of things like mental health issues, substance abuse, addiction later in life. What we've really come to appreciate over the last 25, 30 years is that childhood trauma can also greatly increase the risk of potentially serious physical problems down the road, including things like diabetes, heart disease, certain types of cancer, and can even shorten people's lifespans.
Where did the idea come to evaluate these childhood experiences, and why is this so important as you become an adult?
Right, sure. So one of the big things happened back in the late 1990s. Kaiser Permanente here in California studied 17,000 adults for 10 different forms of childhood trauma. And they found a couple important things. One, they're very common. At least half of Californians had at least one of those happen in childhood. But also there's a very clear dose-response effect. So starting at about 4 major childhood traumas, each one you add on top of that further increases the risk of those serious health issues down the road. And then what happened was, because that, people started looking, what they found is the more childhood trauma you have, the more it becomes toxic, meaning it actually leads to changes in brain development, immune system regulation, hormonal regulation, and even gene expression that can affect things throughout the body.
Let's say I had something that happened to me as a child. I've sort of buried it. And how do I know if in carrying that I don't even realize it and it is affecting me? Well,
one of the good things we're doing with this is, back in 2020, when this kind of got realized it was more just not mental health, it was more of a public health issue, California started this ACEs Aware program, and that was to bring screening for trauma into primary health care. Not only for children at their healthcare visits, but also for adults too, to see if they've had trauma as children. And the reason for that is it allows us to then start providing people with trauma-informed mental health care if they need it, substance abuse care if they need it, and then also to get them hooked into community resources to address the difficulties in their lives.
How do they do that? How does the community get involved in this to connect?
Yeah, so communities can play a big role in this by developing what's called a trauma-informed network of care. And that's what I've been working on where I am. And that's to coordinate not only healthcare, but social services, community organizations, the educational system, the legal system, because they all interact with families, and they're all important on letting families kind of overcome the situations in their lives that are creating that trauma in the kids.
So I guess it's, if you see something, say something. If you see someone who maybe you think is affected, reach out to them, get them help, be helpful, be a community.
Yeah, exactly.
Yeah.
And get them in their doctors so they can get screened.
Okay.
Because it is hopeful. We found that resiliency things, for example, having even one adult that really cares about a child can really drastically lower the risk of those things. So part of it also becomes prevention. So doing things like creating safe communities, other things can really affect kids too, so reducing prejudice and discrimination, make sure people have stable housing and enough food to eat. All those simple things. It's worth doing because I know it's effort and cost in one generation, but if you do prevention in one generation and treatment, the next generation has fewer ACEs. And that's how we're going to break this cycle.
Like it. Dr. Craig Corp, thank you. Appreciate your time.
Appreciate you as well. Thank you.